My name is Laura Coates. I'm a rheumatologist and a researcher from the University of Oxford in the UK. So EULAR 2026, I was able to share data from the TOGETHER-PsA trial. This is a trial that's very recently been published, and this was the first presentation at a rheumatology congress. So we know that patients with psoriatic arthritis are more likely to live with being overweight or obese, and we know crucially that is impacting their outcomes. Patients who are overweight or obese are more likely to develop psoriasis or PsA, and when they are overweight or obese with psoriatic arthritis, their response to our other medications seems to be poorer, and the persistence on drug is poorer. So we know that patients who are obese really struggle to get control of disease. So the aim of this study, which was run in the US, was to recruit patients who had active psoriatic arthritis and were either overweight with a BMI of over 27 and a weight-related comorbidity, or obese with a BMI of over 30, and everyone received ixekizumab. Everyone received some diet and exercise counselling, but half of the patients also received Tirzepatide, so a GLP and GIP medication aiming for weight loss. So the study lasted a year in total. What we shared here at EULAR was the 36-week data, which is the primary endpoint, and we showed a very significant difference in the primary outcome, which was the proportion of patients who achieve ACR 50 and at least 10% body weight loss over that 36-week period. And it's maybe not a surprise that there's a really big difference in that combined outcome, because ixekizumab doesn't work for weight loss on its own, and we know that diet and exercise is also pretty tricky to get a change with patients with significant obesity. But the key thing I think that's helpful for rheumatologists is the key secondary outcome of ACR 50, which again showed a statistically significant benefit. So the patients receiving ixekizumab alongside Tirzepatide lost a significant amount of weight. Their BMI dropped by around 8 points, around 18% of body weight lost. And that was associated with a much higher response in terms of ACR 50. So we can get better rheumatology outcomes and arthritis outcomes by managing not just inflammation from the arthritis, but obesity. So I think this is obviously a first look at really showing whether this can influence arthritis outcomes. There's a sister trial which also looks at psoriasis and again showed a benefit in terms of PASI 100, so we know it can help with skin outcomes as well. And there will be in the future 52-week data from the study as well. But I think the question now is how we implement this and think about this in practice. So there are still significant barriers in a lot of healthcare settings to get access to Tirzepatide, particularly to have this funded. So I think there's questions around access and working with our different local healthcare settings to try and make this a reality for patients. And then obviously this is only a one-year study, which is relatively short in the lifespan of living with obesity, and these patients had a baseline BMI of 38, so very significant obesity. The question then is, what do we do in the longer term? So I think we should be managing obesity. I think we should be considering use of drugs like these where we can. When people get back down to a normal weight, we need further studies about how that's maintained, whether we can taper doses, whether we can switch to maintenance drugs to try and manage patients for the long term.